My name is MRCOG. I'm a member of the Royal College of Obstetricians and Gynaecologists, and I'm currently working in the NHS. I've been guiding the Part 3 MRCOG candidates for the last few years, and through the forum of Grasp MRCOG, I make free videos and podcasts to make things simple for the candidates, and they can also be beneficial for all of us from the point of view of our day-to-day practice. If you want me to talk about any topic that you think is important from exam point of view or otherwise, just send me a message. I'll make a video or a podcast on these topics. Please do not forget to subscribe to my channel and press the bell icon so that you will be notified for my upcoming videos automatically. Thank you so much for tuning in. Hello everyone, I'll be talking about the general gynae module today. Quite a versatile module because of the age ranges that you will be seeing. For example, children, prepubertal girls, adolescents, reproductive age women, postmenopausal women, and also the transgender population. You will be seeing women with a variety of symptoms, but most of the symptoms, thankfully, you are familiar with because you see them very frequently in your normal practice. For example, premenstrual syndrome, and then chronic pelvic pain, menopausal symptoms, and Bartholin cyst, ovarian cysts in an emergency setting and in a non-emergency setting, and so on. Let's see how you can take a scenario. A woman is referred to you because of her heavy menstrual bleeding, and she's referred by her GP after having tried a little bit of treatment which was prescribed by her GP, and now she's upset, and that's why she is here to discuss her concerns and discuss her management options. Just an example. Another example could be a woman who has tried some medicines prescribed by her GP for her premenstrual syndrome, and she is very fed up because it's badly affecting her quality of life. So that's why she wants to have hysterectomy. So just a few examples. In the usual way, you will approach the woman. Introduce yourself. Confirm her name and age. This is an important part of patient safety. And after that, you may ask an open question. For example, you may say, "How may I help you today?" Or you can tell her whatever information you already have. And then you can say that I may ask you a few questions, and then we will discuss the management options. And before you leave from here, I'll give you an information leaflet and also write a letter back to your GP. So how does it sound? And again, starting in the normal way, history of present illness. Ask about her problem. Open question or closed question, depending upon you, but I would suggest open question is always better. In this way, your time is saved, patient will tell you the maximum information, and whatever is left, you can ask later on. After completing the history of present illness, you will ask about the general gynecological history, her obstetric history, contraception she's taking, fertility wishes, cervical smear, social support, family history, medical history, surgical history, any medication she's taking at the moment. Always rule out domestic violence, always do a risk assessment for VTE, and so on. These are the normal things that we do for everyone, but in this scenario, it's always important to focus on her quality of life. Most of the women who will present will be very much frustrated because of their symptoms. For example, after heavy menstrual bleeding, she would say that it's badly affecting her quality of life and she has to take off from work, and she cannot enjoy her time with her children, or it's affecting her relationship with her partner. So these are the things that you have to explore and also show some empathy over there. Whenever a patient says something, do not ignore that. Always address that, always respond to that, because that's a clue and your marks are probably hidden there. And also with your body language and nodding of your head, lean forward a little bit, show empathy. Okay, so this will make a patient very comfortable with you. And then coming to her management options, always mention three things: conservative management, medical management, and surgical management in any kind of scenario. And these things should be in your head, but then you have to see what are the suitable management options for her situation. And also always explore what has she already tried. For example, if she has already tried some medicines, what are the medicines she has tried, and were they the medicines that were prescribed by her GP, or even the herbal therapy. Sometimes women are using herbal medicines or any kind of medicine that will have interaction with the hormonal medicines that you might prescribe them. And similarly, when talking about their medical history, if they are taking any medicines, sometimes anti-epileptics or any other medicines that they are taking, they can have an interaction with the medicines you might be prescribing them. So these are also things that you have to explore and consider before prescribing any treatment or discussing the management options. So coming back to the management options, always 3 options, and I would say that in the beginning, when you are about to start the management options just mentioned, you've got 3 management options: wait and see, medical management and surgical management. And then, so that even if you run out of time, the examiner knows that this is your thought process and you would discuss these management options. Then discuss with them about the pros and cons of each of these options. Because of the time constraint, you might not be able to discuss each and everything in detail. Just keep on asking the patient, do you want to know more about that? For example, when you are telling about surgery, just keep on asking them, because they will guide you. And always keep in mind the fact that the patient is there to discuss her concerns. It's not that you have to display your knowledge. Okay, because everyone after taking the Part 2 exam, they've got a lot of knowledge. Okay, it's how you communicate what you think is important for the patient to them in 10 minutes, and also applied clinical knowledge. It's not about just the knowledge about that problem, applied clinical knowledge for that particular scenario. And that's not difficult. This is what you do every day, and I'm sure that with some practice, you will be able to do these scenarios very easily. When the scenarios are simple, it's more difficult to score high, because obviously the competition is high as well, and everyone does them very nicely. So where you have to stand out is when you do not miss the domestic violence, when you do not miss the quality of life, and when you do not miss asking about the risk factors for DVT. So these things are very important in any kind of scenario, but particularly in the general gynae module. While dealing with the teenagers, you have to be very sensitive and you have to be very friendly. And in the beginning of the scenario, it's very important to develop a good rapport with the patient and make sure that whatever she will discuss will stay with you, and if they even do not want the GP to know about that, you will not share any information with them. And at some stage, you can also ask them about how their relationship is with their parents and how everything is at school, and have they discussed their problem with their mom. So these are the things that you can consider while dealing with teenagers, but I will try to make a separate video on how to deal with teenagers, or the common scenarios with which the teenagers would present in the clinic. So just to summarize that we have discussed is most of the time these scenarios are quite simple, and you have to follow the simple routine pattern of history of present illness, followed by the normal gynecological and obstetric history. Do not forget about the social circumstances, effect of her problem on her quality of life. Show empathy, and empathy is not only through your words, through your body language. For example, you can say that I can see that you're going through a very difficult time, and this problem is affecting your quality of life and your day-to-day routine and also your relationships. But don't worry, we are here to help you, and there are things that we can definitely do for you. So she will be reassured a little bit. So this is all about general gynae module, and if you want me to make another video on any topic of your interest, please send me a message and also give me feedback. Thank you very much for listening.